So, as Warren presented us, I'm Diana. Alongside my colleagues Emily and Ben, we'll be presenting a first-year update of our retrospective and prospective natural history study. We do not have any disclosures. And here we have a little slide presenting all of the amazing people on our team for our natural history study, starting, of course, with our principal investigator, which is Patricia Mussolino, that I think you all know and love dearly. And our site principal investigator for Masa Year is Ramesh Patel, alongside all the other co-investigators that all of the kids meet during the natural history study. We have some new neurology junior faculty helping for the study, which some of you have met, is Kendall Hadid. And today you heard a talk from Nathaniel Robbins. Also for cardiology, you know Mark Lindsay. You just heard a talk by Bernard Kinan. And for hematology and second stroke prevention is Eric Grabowski. For physiatry is Brian Wishart. For ophthalmology assessments, for ophthalmology assessments, the kiddos are seen by Dr. Ramesh Patel and Ryan Gies. And the neuropsychology assessments are done by Julie Greco. We have an amazing team for physical therapy assessments, which are done by Alice and Aileen. For gastroenterology, they are seeing Dr. Zal Kessler or Alan Goldstein. And for genitourinary disorders or symptoms, they're seeing Jack Elder. The last but not the least, our amazing nurse practitioner, Erica, that are currently on maternity leave, not with us, but she is an instrumental part of our team. And here is our clinical research coordinator team, myself. I am an MD by my graduate degree is an MD, and I'm a neurology residence applicant for this cycle. We have Emily here, which is a Duke graduate, and she's an incoming medical student at Columbia this August, and we are saying goodbye to her today, tomorrow. And Ben, which is the last addition of our amazing team of clinical coordinators. He is a University of North Carolina Wilmington graduate, and he's applying to medical school this cycle. And here's a graphic representation of our study that is very familiar to the participants, but less familiar to other families. We have two arms. One arm is retrospective, and the other one is prospective. The entire study goes on for 40 years. 1 year is the baseline and another 3 years. The prospective arm of the study is comprised by several time points. We start with a baseline clinic visit, which is an in-person visit, which we collect different data. The kiddos do different physical assessments. As you heard, they see all of the specialists mentioned above. They do different physical examinations, autonomic testing, imaging. Every assessment that the children do during this natural history study are standard of care. So they all receive all their medical records, notes, imaging that they can share with their local team, and they have continuity of care throughout this study also. And we collect some blood work and skin fibroblasts for our researchers to study. It's every 6-month mark during these years. We have a remote visit. We usually do it through Zoom. The family and the patient or participant meets with us. Usually the research team, we ask about any relevant past medical situation that happened during the 6 months. We administer questionnaires and caregiver surveys for the family, or if the child is in our second cohort in the prospective study, old enough to fill out the caregivers or the surveys by him or herself. And we send out some wearables. Some of the patients already know what's that wearable, and it's an actigraphy watch that is tracking the physical activity during the sleep and awake hours. They are usually worn 24/7 for 5 days straight. And a lot of kids ask us, why not an Apple Watch or why not a Fitbit? Well, the explanation for that, I think you heard today. We are using different tools or wearables that are FDA approved, and the data from those wearables are approved to be used in different clinical trials and validated. So we will be able to use that we'll be able to use that easily in future clinical trials. And to wrap up my part of the presentation, I'll present you the retrospective cohort. We are actively enrolling patients in this arm of the study. We are looking for patients with any confirmed ACTA2 mutation from 20 days old to 100 years old. This part of the study is medical review and medical records collection and review by our team. And we are looking to understand disease progression, identify biomarkers, and define different trial endpoints for future clinical trials. At the moment, we have 13 patients consenting to the retrospective arm. If we are enrolling actively, if you are willing and open to, at the end of the study, Ben will show you the email address and the QR code that you can scan to copy the email address, and you will reach our team at any point in time.
Alrighty, I'll be talking a little bit more about the prospective arm of the study. So what differentiates the prospective arm of the study is it requires in-person visits to MGH or Boston for 4 years. And we're looking at participants who have a variant in the ACTA2 gene, specifically at the R179 site, leading to MSMDS. And we are looking at pediatric patients. So we're looking at children who are 18 and under. And when they are here, as Diana mentioned, they're going to be undergoing a variety of assessments looking at all the different systems that are affected by MSMDS. So there's ophthalmology, neurology, cardiology, pulmonology, hematology, GI, autonomic testing, urology. I'll explain a little bit more of it in detail later, but just to give you an idea that we are looking at the entire body and all the systems that are affected in our patient population. And as I mentioned, it requires 4 visits to MGH and to Boston. It happens the same month of each year. And this allows us to kind of have standardized assessments and check-ins with the patients. And then, as Anna mentioned, we also do virtual check-ins at the 6-month mark. We do caregiver assessments to hear from the experiences of caregivers, what are the symptoms that are most prominent and relevant in their lives, and what their input is. And then we also collect that activity component as well. And this is a way for us to uniquely collect standardized data on our rare cohort and have specific time points and understand individual disease progression. This individual disease progression will allow us to identify biomarkers and endpoints for individualized therapeutic trials. And at the moment, we have 16 patients consented to the prospective arm, and 13 of them have already been seen for their baseline visit. So at the moment, we have patients from all around the world. We have many from the United States, but we reach Asia, we reach Europe, and this allows us to get a very comprehensive understanding of what the MSMDS lived experience is, because we're seeing the experience from patients from all around the world. And to give you an idea of what does it look like when you come to Boston as a participant, here's just a mock schedule of the week. So you're going to be having imaging of the brain and the heart. There is the neuropsychology assessment. There is ambulatory blood pressure monitoring, which is something that was touched upon in Dr. Robbins' talk this morning. We have a physical therapy assessment, an echo and EKG. We have a multidisciplinary clinic where our patients get to meet with our neurology, physiatry, hematology, and cardiology teams all together and see how they can provide input for the patient in kind of like a one intimate setting all together. There's pulmonology, transcranial Dopplers, ophthalmology, autonomic testing, and then depending on the symptoms of the patients, because as all of you know, it is kind of case by case how affected systems like GI and GU are. We add on those assessments as well. And what makes this week doable is that we have really wonderful child life services here that make this as easy of a process as possible and ensure that our children feel seen and represented the entire time they're here and not just kind of being pushed and prodded from visit to visit. So we have wonderful assessments with an incredible team. We have an incredible team supporting our patients and the families the entire time they're here. And something that's really special about this study is that our providers are really well versed in MSMDS, and they can provide personalized information and care for our patients in all of these different domains that we explore. So it's something that is really special to our families and something that we'll touch upon later for sure. But just to recognize who's doing what, it takes a whole village, and all these providers, nurses, medical assistants, everybody play a huge role in making this task possible. So you're probably wondering, what have we learned in the past year? We'll begin to touch upon what we found from our 13 prospective patients who have been seen thus far. We see that there definitely is variety within our cohort, but one of the things, or two of the things that we see that all of them have experienced is white matter hyperintensities in the brain as characterized typically by an MRI. And they've all had PDA or APW repairs typically early on in life. There are two who have had aortic aneurysm repairs. We have largely R179 histidine variant, but we also have one with the R179C variant as well. And we have both female and male participants. So one of the assessments that I mentioned earlier was the physical activity or physical therapy assessment. And during this, there are two main assessments that we do that allow us to understand the abilities of our patients. One of those is a timed walking test, and the other is a gross motor function assessment. During our timed walking test, we find that all of our participants are having a decreased endurance given the predicted values for their age and sex. In terms of the gross motor function, we find that while most of our participants can complete more than 50% of the foundational domains, which include sitting, when we get to more of the higher complex domains, such as crawling and kneeling, standing, walking, running, and jumping, we see a fall off in the completion abilities of our patients.
Another measure that we look at in these patients is for their arterial blood pressure monitoring. So we give these kids a blood pressure monitoring cuff that we put on for 24 hours during their initial visit. And we'll repeat this every year that they come to Boston. And it's a way for us to track both the awake and sleep periods for their blood pressure monitoring. As you can see by this graphic, most of the participants that we have are under the median mean arterial blood pressure monitoring. And so it's a way for us to track both their awake and asleep measures. Another measure that we do is caregiver surveys. So some of these are completed through the neuropsych assessments. And so families are required to complete these to better understand kind of the day-to-day life of these patients, as well as how they are affected individually by the different symptoms that they have and the level of completion of different tasks, whether that be in daily life, motor skills, etc. One of these is the Vineland Adaptive Scores, which is we found that more than 50% of our participants were lower than one standard deviation than the mean in measures like communication, daily living skills, and motor skills. We also found that in over half of our participants, we also found above average completion in socialization. We also looked at the pediatric quality of life, which is more of a health measure and relates to disabilities and disorders outcomes. And so we found that more than half of the participants were also one standard deviation below the average in physical activity and social health and social function. We also noticed that additionally, we found that the emotional and school functioning abilities were at or above average for the same cohorts. And so all of these measures that we gather is really helping inform the laboratory and clinical approach to reaching towards different genetic therapies and interventions for these families. All of the information that we've received from the initial 13 kids that have been seen prospectively, as well as the retrospective records that we've been able to collect for those 13 patients that have enrolled, is incredibly helpful as we communicate with the FDA in order to progress gene therapy efforts. On March 5th of 2025, there was a pre-IND meeting, which is a step towards authorization for genetic editing and therapies. And they recommended us for funding. We've already been awarded 2 grants by the NIH to be able to further support the move from bench to clinical translation. And then we've noticed that the families have a very difficult week sometimes with all these appointments. And so we really like to get the feedback from the parents and the kids on how the different therapies and interventions that they've received from our team as well as from when they're home, and how those things can combine. And one of the main things that we hear is that they feel like when they go home, they have a better understanding of the type of care that they have received, as well as how that can progress to their normal daily life. The specialists that are in Boston are incredibly versed in MSMDS and can provide a lot of recommendations to the families that they can then give to their local team to enact on a daily life basis. We also noticed that the families form such great connections with other families that have gone through a similar experience. It's incredibly meaningful to be able to talk to someone that has a kid with a similar background and has had similar experiences and symptoms. And so a lot of the months that we bring kids to Boston, we include two families so that they're supported and feel like they can have someone there right along with them. And then we also give them all of the recommendations, notes, imaging that they can take home to their local team as well, so that they feel better supported within the community. And these are just a couple of the testimonies that we've received from patients that have been a part of the study so far. And here you can see just a clip of some of the photos that we've taken with the families that have been a part of our study. We really wouldn't be able to do any of the research that we're doing without all of their support and contributions. We try to make the week as enjoyable as possible with Diana, Emily, and I. And so we try to make sure that while we are getting all of those study assessments 5 days a week, going through and really making sure that the families feel heard, understood, that their child is having a positive experience through the healthcare and through the hospital that we are providing. And so we are very appreciative of all the efforts of the families that are part of this community. And we also want to thank all of the researchers, all of the physicians that see these children that have really gotten a much better understanding of the type of care that is needed, as well as understanding how the disease progresses over time. That is really our best understanding of trying to get genetic therapies and different interventions, is by understanding how the disease progresses. And we also want to thank all of the laboratory technicians, all of the research scientists, and anyone else that has been a part of this study, including the ACTA2 Alliance and YGSA. They have been instrumental in helping us reach the patient community to be able to provide our efforts. And then, like Diana had mentioned, the retrospective arm of our study we are actively consenting for. It's a great way for us to be able to receive medical records, to understand how different children and adults have had care treatments done, and how those symptoms might have progressed with time. And so if any families are interested that have not already taken part in it, we would absolutely love for you to connect with us. You can find us anytime throughout the conference, but we also have this QR code and our lab email that we are constantly monitoring to be able to help all the families that are interested.
Thank you.
Thank you.
I didn't have a question, but I did just want to say, so from our perspective, every time we come in for the natural history study, it's always a really great experience. I know that you guys work very hard to make the schedule as compressed as possible, so we're not sitting there for extended periods of time trying to keep a 7-year-old entertained and everything. I always feel kind of like a VIP, like a strange VIP walking in. They're checking you in, they're talking to the doctors and the front desk staff and everything. They make it, at least for me, they make it so seamless and everything. It's nice to be able to not have to think about that stuff. You guys just take over and get us what we need. So I really appreciate all the work that you guys do. Thank you.
I just want to add that you had a slide that none of you have any conflicts of interest, which is absolutely a lie, because there's like 12 of them right next door. The kids have such a great time with you, and your pictures show that, and you're a huge piece of this. So, like, to echo what Warren said, thank you.
Anybody else? Okay, thank you very much.
Sorry, the Malay family says thank you, Emily, Diana, and Ben. See you soon.
Wow.
Yeah.
Very sweet.
See them in 2 weeks. Thank you very much.